Hello, my name is Liz Beverly. I'm Associate Professor in the Department of Primary Care at The Ohio University Heritage College of Osteopathic Medicine. It's my pleasure to present findings from a brief training program that was designed to improve knowledge about hypoglycemia and glucagon administration among school personnel in rural southeastern Ohio. This study is brought to you by a grant from the Health Resources and Services Administration, and it funded a school navigation program for children with diabetes. So we know that in rural southeastern Ohio, full-time school nurses are in short supply. And because of this, school personnel are often asked to step in and provide some level of medical care to children with chronic conditions. So for a child with diabetes, what this may entail is providing insulin injections, blood glucose monitoring, treating hypoglycemia, which is a low blood glucose value, and in severe instances of hypoglycemia, it may be glucagon administration. Hypoglycemia can be caused by a missed meal, by exercising too much, or by not eating enough food for the amount of insulin a child was given. And if hypoglycemia is not treated immediately, it can become severe, which can lead to loss of consciousness, seizure, coma, or death. Now, a child will need glucagon for a severe hypoglycemia in order to restore blood glucose levels to normal. So for these reasons, it's really important that we train not only school nurses about this, but school personnel who are helping the school nurses to train them about diabetes, hypoglycemia, and glucagon administration. Which brings me to the purpose of what this study was, which was to assess the effectiveness of a brief interactive training program that was designed to increase knowledge about diabetes, as well as to increase knowledge about hypoglycemia and glucagon administration. So a team at the Ohio University Heritage College of Osteopathic Medicine developed a 1-hour hypoglycemia and glucagon training program. This was delivered by our child diabetes navigator, Dr. Rochelle Rennie, and she was the physician on the team. It was also supported by our certified diabetes educator, Karen Bailey, and myself. And what we did is we asked school personnel to take a pre-survey and then after the training take a post-survey. And this measured experience with diabetes as well as some diabetes-related knowledge. And you can see here in this image, we had individuals who participated practice administering glucagon on this practice kit. So you can see this is what a glucagon kit would look like. And you have a little bottle that would, in real life, contain a solution that would need to be mixed. And then you have the syringe, which would be used to inject the glucagon after it was mixed. And then we provided hypoglycemia kits. So this is something that we provided through the grant to all of the children in the different school districts that we are working with. And this is children would be given these kits so that if they had hypoglycemia throughout the day, they would have the supplies. And this just ensured that all children in the schools would have the necessary supplies to treat hypoglycemia. These kits included blood glucose meters, it included gloves, bandages, alcohol wipes, tissues, as well as things to actually treat the hypoglycemia, which would be glucose tabs, glucose gels, meal bars, and crackers. So we had 48 school personnel participate. The majority of the participants were teachers. You can see 70% were teachers, but we also had bus drivers, we had cafeteria workers, we had office staff, and we had principals. So just looking here, there are 10 questions for this knowledge test, and you can see we asked about what diabetes is, we asked them about what is hypoglycemia, and then we asked them about glucagon. You can see from the conclusions here that this 1-hour training improved diabetes knowledge significantly. And by looking at this figure here, you can see that pre-test scores on this knowledge test were 52.5%. Following the training, the knowledge scores were 73.5%, which shows a 21% increase about their knowledge, which is a significant increase. So what we're showing here is considering the severity of hypoglycemia and the amount of knowledge it would take to administer glucagon. School nurse personnel as well as school nurses need to be trained to learn about diabetes emergency care so that they can assess and treat children's hypoglycemia during the school hours. And what we're trying to show is that this training program underscores the value of training school personnel. School personnel can learn how to do this so that they can actively assess and manage the risk of hypoglycemia in children with diabetes. In the future, what we plan to do is, given the current COVID-19 pandemic, we have taken this in-person training program and we have converted it to an online virtual program. And we've added some virtual reality to make this program even more enticing. And what we're going to be doing in the fall is we're going to be taking this online module and distributing it to school personnel at different districts within southeastern Ohio to train school personnel as well as peers and family members. And we're going to compare the effectiveness of the online module to this in-person module. Thank you very much. I really appreciate you taking the time to listen.